three of the people on the call are in different locations doing what we can to keep ourselves safe and healthy, and hopefully you're doing the same. For the call today and for the webinar, all lines will be muted, but as it says here, make sure that we're using that chat function. We want to hear from you. We want this to be interactive and really want to be able to respond to the needs, questions, and concerns that you have. So please use that function. My name is Rob DuPont. I'm the Vice President of Behavioral Health at Mission Health. And our panelists today are Dr. Rick Zen, the Medical Director for Behavioral Health at Mission Health, and Don Klug, the President and COO of the Employee Assistance Network. And we'll get to them in a moment. And before we do that, just want to reflect some on what brings us together today and what we want to talk about. The coronavirus has impacted every one of us in multiple ways, schools, employment, just our daily routines in every aspect of life. And for me, I think it's not just the changes that have occurred, but how fast all of those did occur. Some of that has settled and we're almost coming into a new routine. And while the initial focus had to be on physical health, making sure that we were identifying the virus, keeping people from getting the virus, keeping everybody physically healthy, that's vitally important. Now I think it's really important that we also take time for our emotional and our mental health. It's hard to have good physical health without mental health, and mental health is physical health. So our time today is to really reflect some on that. Where are we currently? What are the struggles and concerns that we have for our current state? And as things transition, what is that going to look like when we come out of this? What is that new normal going to be, and how do we get back into the routines that we once had? So with that, I want to give our panelists an opportunity to introduce themselves. So I want to hand it over to Dr. Rick Zen.
Thanks, Rob. And I couldn't agree more that right now with our physical health issues, you know, most of us have been able to stay safe. It's actually been quite impressive, I think, the response on a local level and a national level and even a global level in terms of how seriously everybody has taken this. And that's really to everyone's credit. But one of the hidden problems that maybe doesn't get discussed enough is the mental health complications of going through the process that we've been going through. So I think it really makes sense for us to talk a little bit about how best to cope during these very stressful times. Anxiety is also one of the new normals that go along with what we're dealing with right now.
Well, thank you for that. And Dawn, I want to give you the same opportunity to introduce yourself and have some opening thoughts.
Great. Thank you so much. I'm Dawn Klug, and President of Employee Assistance Network. I've been working in the employee assistance field for over 20 years now, and we've helped a lot of people through a lot of crises and dilemmas in their lives, but this is unprecedented. And I think the thing that is impacting us the most is the uncertainty and the unknown. That ramps up anxiety for anyone, that lack of knowing what's going to happen next or what to expect. So even if you've never had anxiety before, it's very common for people to be experiencing that anxiety now. And that unknown, that not knowing what to expect, what's going to happen, when are things going to go back to normal, what will normal look like, all of those things are the things that we're all grappling with. And so as communities, we're really having to look at and face how do we manage that anxiety. And I think people are really looking for ways to help themselves through this crisis, and looking for new and different ways in which to move into this uncertainty. So I'm hoping we'll be able to help people with that today.
Well, thank you, Dawn. And I think that could be a good place to start. How do people identify what is a normal response of anxiety related to COVID-19, and what would be more of a concerning response?
So, Rob, as a psychiatrist, I help people deal with anxiety all the time. You know, anxiety and fear are related. They're the same type of physiologic responses that we have. Fear is in response to a direct threat. You know, if we had somebody saber-toothed tiger jumping at us back when we were cave people, it would be a natural reaction for our bodies to get revved up and to be able to go into a fight or flight mode. Anxiety is the same physiologic response, but there's no direct threat. It's more of a perceived threat in the future. And that can be trickier because it's still there, it's still valid, and we're still feeling that way. But it can be hard to deal with. With COVID, it's a little bit of a mixture of both. And we've seen the effects of this virus, and it's very serious. So there is a real threat there. But the worry about whether we'll get it or not and the what ifs, kind of go along with anxiety. And in this case, it's normal to be anxious about that threat. So that's a normal response. Where it starts getting problematic is if the anxiety is something that dominates our life. If we can't go about our routines, if we can't work, if we can't parent, if we can't have relationships with others, or if it's really interfering with our ability to do those things, that's when it starts to become a problem. If we find that it's intruding into every aspect of our life, if we just can't get it off our mind, that's when it may go from kind of a normal level of anxiety to something that really can become more problematic.
Great. Well, thank you for that. And along those lines as well, so we've talked about one of the things you mentioned, being socially connected. So social isolation has been a major part of our lives for the past several weeks. That challenge of staying connected while being socially isolated is certainly something that we're dealing with. How do people continue to stay connected while still being socially isolated?
Dr. Zen, I'll jump in here if that's okay.
Sure.
I think people need to be willing to experiment and try different things. A lot more people are using platforms like we're on today that have never used them before. And I think that willingness to engage with people in new ways, we have a lot of technology at our access that is really helpful and can help us stay engaged and be able to have communication with others. I think the social distancing reference is unfortunate because it's not really social distancing, it's physical distancing. It's about having physical space, but not necessarily disengaging with people in a social way. So one of the things that I think is important is that we need to be willing to create ways in which connecting, using apps that help us to be able to communicate, reaching out on the telephone. Old-fashioned telephone calls are becoming much more popular again. Those kinds of things that really allow people to do it differently. It's not about not being socially connected. It's just about doing it in a different way.
Well, thank you, Don. Dr. Zen,
Sure. Yeah, thanks, Don. I agree with those aspects. For some of us that are relatively averse to social media, it's an opportunity to learn that actually these are tools that can really help us with social connectedness, rather than keeping us socially distant. We have to be careful how we use it and make sure we're using it in a productive way, because there can be some negativity in certain groups. So making sure that you're using it positively is important. I think all of us are going to be changed in terms of our use of video conferencing as we're doing right now, and learning that actually this can be a great tool. It's an opportunity for us to make connections with people that maybe we haven't connected with in a long time. I've had some video chats with some friends that I hadn't talked with in a while recently, partly because I've had the time to do that, and because that's become our way of socializing now. So there are opportunities there. And with those that we're socially isolated with, at least much of the time, our friends, our family that we're directly with, it gives us an opportunity to maybe look at the nature of our relationships there, and to have deeper conversations, get to know each other on different levels. So there are some real opportunities here also by being in a position where we are socially isolating together. And it may provide the opportunity to repair some some relationships that have been frayed. If nothing else, this helps us put things in perspective, dealing with a crisis like this. That there are things bigger than us that we have to deal with sometimes.
Well, great. Thank you both for those thoughts on that. And the mention of technology and the use of that also brings to mind some of the rapid changes that have actually been beneficial in making sure that people are going to have to stay further apart, but how do we maintain access? And so telehealth, telepsychiatry, which certainly impacts on the work that we do, and certainly has impacted on other aspects of healthcare as well. But knowing from a local, regional, and state level, from what the state of North Carolina has done and conversations with the Department of Health and Human Services of really concerted, fast efforts to create avenues to access telehealth in a way that has never been available before. And so as we talk about access and services, and that will be certainly one of the topics that we touch on, I think one thing that is a positive is there are ways to access services in new and different ways, and we can still be in our home and in this sort of setup where we are, all in different locations, but still have those services that we need, knowing that mental health doesn't take a sick day, and emergencies can happen at any time, and whether that's around a mental health crisis or any other health crisis as well. So definitely some, I'd say, one positive change has come out of everything here. So Dawn, one question. Here's what I want to stay informed about what's going on, but watching the news is making me more depressed. What are some tips around how do we balance that in our lives?
Yeah, that's always one of my first questions when somebody starts talking to me about feeling overwhelmed is, how much news are you listening to? And maybe it's time to turn it off. There's a balance in there between wanting to be informed but being overloaded. And what I usually recommend to people is that you pick a time maybe in the beginning of the day and the end of the day to check in, listen to a brief news report with an organization that you feel is trustworthy, that you feel is giving you accurate information, and maybe tune in twice a day for a brief amount of time. And maybe even have an entire day where you don't listen to the news at all, or you take a complete respite from it, can really be a benefit. But having the news on all day long and a continuous feed is not healthy for us, especially hearing things over and over and over again. So we really need to limit the access for that. And again, choosing one or two news sources that you feel are really reputable, that you can trust, would be really helpful, but you don't need to read every single thing that's coming through on social media or every single article that someone is sending you. It's okay to choose not to look at every headline.
Well, thank you. Dr. Zen, any thoughts on that question?
I agree 100%. I think limiting it, scheduling it at certain times, and really planning on not having it be, a continuous type of thing is great. I know my phone reminds me of news breaking all the time, and even that, just gets to be intrusive. So really being able to deliberately shut that off is important.
Well, thank you. And Dr. Zen, I'll stay with you for a moment here. A question that came through is, or a comment, but also a question with that, if dealing with all the stress and anxiety around COVID is particularly hard for people who have had other traumatic experiences and things in their past. Can you touch on how those can be related?
Absolutely. And this is an issue, for people who already struggle with depression, anxiety, effects of trauma, having our isolation and the anxiety related to COVID can just trigger us. So it's something for us to be aware of. I think there's a few things that are important. Now is the time definitely to keep in touch with your provider. If you have a mental health provider, psychiatrist, a therapist, even a primary care doc, it's important to stay in touch. We have means to do that now, as Rob, as you pointed out. Pretty much every provider that I know has the means now to provide telemental health coverage. It's out there. If you don't have a provider, don't be discouraged. You can find people who will help you now. You can find therapists who will help you with this. It's important to be able to talk about how you're being triggered by the events that are going on right now in order to deal with the anxiety that naturally is taking place. So I think these are important issues. If someone is on medication for these types of disorders, now is not the time to stop your medicines. The pharmacies are open. They're working with us in terms of delivery and having safe means of picking up prescriptions and medications. So it would be important to stay with your medicines and talk with your providers about that. Make sure that you're keeping in contact about that aspect in case there's any adjustments that you made. So those are just some things I would mention. If you're finding that you're more depressed, some of the issues that would lead me to think that maybe it's getting a little more serious is if somebody starts developing thoughts that life isn't worth living anymore. That's a symptom of depression, so it's not uncommon for people who are depressed to have those thoughts. But if they're becoming more frequent, more intense, more intrusive, then it's important to be able to talk to your provider about that. And if it's urgent, then there are hotlines and there are means of getting care urgently. The emergency rooms are still open, and so it is possible to get help urgently in those situations.
Great, thank you for all that information. Dawn, any other thoughts on that topic?
Yeah, I think, reaching out and identifying that, like any other chronic mental health issue that you might have, there are times when it's going to be a little harder to manage. And there are the things that you do to manage depression or anxiety under normal circumstances probably just need to be increased. They probably need to be ramped up, the things that you would normally do. So if you're somebody who exercise helps you manage your mood, then you probably need to be exercising a little bit more, not less. If you're somebody who needs time for reflection and meditation or prayer, then you probably need to build in a little bit more time for that during your day. All of the things that you have already built into your self-care plan, not only do they need to be continued, but they also probably need to be increased. And one of the mistakes that we tend to make is when there's a time of stress, we do less of the things that help us rather than doing more, which is what we need to be doing. So I would really encourage you to build in that schedule. One of the things for many people who are not currently going to work, even people who are working from home, are really struggling with that lack of structure, that lack of, this is when I do this thing. And so building in some structure into your day so that the self-care is a part of your already scheduled events. This is the time of day that I do this thing that helps me. Maybe it's go for a run or a walk. Maybe it's do some mindfulness exercises and some meditation or some journaling. Whatever those things are that you already know help you, build them into your schedule and do them more, not less.
Well, great. Thank you, Dawn. And staying sort of on that theme, we're talking about self-care, and I think it's also important we have maybe elderly family members or kids, and so some of it we need to be able to take care of ourselves before we can take care of others. But can you speak some to how do we address that if we have other family members that are harder for us to get access to, like maybe an elderly family member that doesn't live with us, or maybe how we're going to support our kids through this as well?
Yeah, absolutely. I think that, as Dr. Zen mentioned earlier, now is a time to reach out more, and people are connecting and to people that they haven't talked to in a long time. Building in, if you have somebody who's at a distance and who you can't physically be around, building in times to how do I check in with that person? How do I communicate with them? The regular phone calls, the digital meetings like we're doing right now. Also, if you have the ability to have somebody who's nearby that is able to, drop things off for that person, is able to make deliveries if they need that. Having a safety net of someone who is there, whether it be an individual or organizations, can be really helpful. 211 in most communities is a really good resource for things like that of, what are the resources that might be able to help somebody who's elderly, or somebody who isn't able to get out on their own to take care of their needs. How do I build a safety structure around this person can be really helpful. It's really about
Great.
planning.
Dr. Zen, do you have thoughts on that topic?
I do, and talking a little bit about our children, our children really pick up on how we're acting and feeling. So if we're feeling very anxious, they're likely to be anxious too. Certainly, acknowledging that we're anxious is important. We don't, that we're experiencing that, so there's no reason to hide the fact that we're feeling anxious about the whole situation. But having a sense that we can cope and deal with it is important in order to help them get through this too. That idea of routines and structures, I think, is really important. Our lives have been disrupted so much, and our children's lives have been disrupted with classes now taking place online, not being, expected to get to school at the same time, not having all the after-school activities that they usually have. There's quite a change, but there's opportunity there too. So there's opportunity to do other things, to structure days in other types of ways, to spend time together, to read together, to work on a project together, to exercise together. So there are things that can be a benefit now in terms of the relationship with our children that maybe we didn't have the time or the opportunity to do before. So being able to fall into those routines, maybe develop some rituals that are healthy, bedtime rituals or certain times of day where you plan an activity together, can be meaningful and can provide some structure to our kids' lives.
Well, thank you. And as we were talking about the need for some social isolation, of course, we also need to be going out in public. And so similar theme, but more specific question around if we have a family member who is anxious about loved ones dying because they need to still go to work or they still need to go to the grocery store, and how they feel like that's putting them at risk, and that anxiety that comes up around that, knowing there still are essential life things that we need to do. How do we support a family member through that?
It's a very good question. It's hard, because if somebody is concerned about us, it's understandable that they would want to, that they might worry about the what if. So I think one thing is to reassure with statistics and, to be able to say, the incidence of new cases is dropping. So as long as we maintain our social distancing, follow the recommendations and guidelines, and keep our distance, then going to the store, doing some of these functions that are essential are safe, at least as safe as can be. I think sometimes there's an issue of control that occurs, that people may want to control variables that really are a bit beyond our control. So we can control to a degree our exposures, but we can't control every exposure. So being mindful of that and being able to kind of frame it that way, that when people are anxious, they may try to control more, and they may verbalize that, try to control interpersonally by saying, "Don't go out. I don't want you to do these things." So being able to reassure that we understand that they're anxious, but that certain things are essential. Going to work now for some of us really is still essential.
Yeah, thank you for that. Dawn, any thoughts on that topic?
Yeah, I always encourage the family members to know, as hard as it might be, you're the role model for that person. You might be the link to what's sensible for that person. And so, as Dr. Zen mentioned, talking to them about the reality of the statistics, the reality of, how I'm being safe, but also not getting too bogged down in all of that. Distraction can be a really helpful thing sometimes for anxiety. And so, getting that person to focus on, let's focus on something else now. Let's go watch a funny movie. Let's go for a walk in the neighborhood. We can still walk in our neighborhood. Let's go do that. Let's play a game. Getting that person to help focus on something else. And if they're really not able to do that, maybe giving them something structured to do, like, okay, journal for me how you're feeling. Let's write that down, and then we can talk about it. In giving them that outlet so that you're hearing them and not just completely dismissing them, but you're also not feeding into their worries and their fears.
Definitely a balance of supporting and acknowledging, but also being able to continue to work through it. And thank you both for the feedback on that. Don, I've got a question here that I think is more in your area, and then certainly if Dr. Zen has thoughts on it as well after. But if I'm an employer, what can I do for my employees right now to support their well-being?
Yeah, this is a big one a lot of employers are facing. And there's kind of two issues that we hear from employers and what they're dealing with. One is we have essential workers. We need people who have to come to work. And yes, they are, potentially being exposed. So how do we manage that? And of course, there's, making sure that you have the personal physical equipment that you can to protect them, doing everything you can to create safety for them. Also allowing them to express any of their fears or concerns that they have, allow them to bring them to you. But as an employer, it's really helpful if you can be the voice of calm. Again, if you can be that person who can help with, okay, here's how we've problem solved around the concerns, and here's everything that we're doing to help make sure that we're being as safe as we possibly can. So that's an important piece. If you're an employer who has not been able to maintain people at work, if you've had to close due to the restrictions, and people may be furloughed or laid off, it is also really helpful to be able to check in with those employees, even when they're off. How are you doing? Are you okay? Do you have everything that you need? Those kinds of things of just making sure that your employees know that you're still there and that you do care about them and that you do have whatever your intention might be in regards to the ability to reopen or to not, to communicate with employees as much as you possibly can.
Well, thank you, Don. And certainly the employment issue and that topic is a huge one right now. And whether you are considered an essential worker and those challenges and the anxiety about going into work and leaving the house, and then even more so on the side, if you've been furloughed and just for what your job is currently not available right now and creates a huge bit of uncertainty for us right now. And so thank you for touching on that one. And Dr. Zen, any other thoughts related to that from an employer standpoint?
But I think having employee assistance available, is really crucial. So, having people like Don who are so in tune to what employees need is really crucial. And for smaller businesses, having, developing some resources to be able to have employees have access to is important.
Thank you. And I will mention that most of the time, if an employer has a benefit like an employee assistance program, even during a furlough or a layoff, that benefit should still be available to those employees. So that's an important question to be asking if you're an employee. Do we still have access? What benefits do we have access to? So that can be an important question.
A very important point as well. And certainly, as we mentioned, access to resources and so having the ability to continue to access that is huge. We are getting questions coming through the chat line. I appreciate everyone sending those in. And I have one here that is, I'm going to say it's a challenging question and very, very important for where we are here in the area. And so this question is, There's a digital divide that's very pronounced in Western North Carolina. Many people don't have access to internet, are limited with data and phone minutes, and have a lack of transportation. We have this opportunity to be on the webinar, and certainly we are privileged to be able to do that. Can each of us speak to how we're reaching out to those who are not connected as you are? And I'll touch on this briefly. And one thing that we're doing is making sure that we're staying connected with all other agencies and that are in the community, and to make sure that those topics are being covered as much as possible, and so we can get resources in the right places. And those topics are housing and around homelessness, and access to continued medication and therapy and other mental health services, and certainly on the hospital side for emergency services, and what is the safest and best access for people to continue to do that. I know VIA has stepped back. I think the state has made it available for VIA to make other resources available for our region as well, and I know that they've been very active in that. And I think one resource that I was hearing about even just this week was access to phones, and trying to make sure that people who might not have access before have access to those resources to be able to stay connected and make sure that they're getting the help that they need. Dawn, can you speak to that one at all?
Yeah, I think that if they do have a phone, good old-fashioned phone calls are one of the best ways to reach out to somebody and to be able to communicate with them. And again, it's important to remember that we're talking about physical distancing, not social distancing. I have a good friend whose parents are physically compromised and they really need to be careful. So she goes to their house and parks in their driveway, and they come out on they have a little patio balcony. They come out and sit on the patio balcony, and she sits by her car and they have a conversation well over 6 feet away from each other. But they're still able to talk to each other, and they're still able to see each other. So if you can do that, if you can, walk across the street and talk to your elderly neighbor in the yard, just to check in and say, hey, do you have everything you need? I'm going to go to the grocery store. Can I get something for you? Those kind of things can go a long way. As much as we can really try to look out for one another, and if you know that person who might not be connected in that way, whatever you can do to reach out to them in a safe way can be really helpful and make a big difference. For most people, while the physical safety is important, the idea of knowing that there was somebody who cared enough to reach out for me, to check on me, to go out of their way to say if I was okay today, really can make a tremendous difference in our morale and how we feel about life and about the world. So anything you can do to go a little bit of the extra distance in a safe way can be really helpful.
Just to add to that, Dawn, not only is that good for the people that we're reaching out to, it's actually good for us when we do that. So one of the things that can help us during this difficult time is for us to actually, as much as possible, to try to volunteer to show compassion and help others during this time. We gain from that too. So I think that's really, that's an effort, whether it's through church or through through other organizations, being able to reach out to those that may be suffering a little bit more with isolation can be helpful in whatever means possible. If they have the technology means, that's great. If they don't, then maybe doing some of the things that you talked about. And Rob, just to follow up on something you said, mental health services are essential services. And though we're converting most of our services, and most providers are trying to convert to online types of means and virtual means, there still are the capabilities of some in-person services for people that just don't have those capabilities. So, using appropriate social distancing. So that's important for people to know.
And that's a very good point and great reminder that there's hybrid, right? So we're using the virtual capabilities as much as possible and trying to promote that, but those in-person services, while maintaining it in a safe way, can still be available. And also, thank you for mentioning the essential services. For early on in this, of essential services could stay open. And so there was that question of, well, what exactly is an essential service? And certainly we all know and believe mental health is an essential service. And so those do continue on. Another work-related question that's come up, Dawn, if you want to start on this one. If it's your job to update your agency corporation on the effects of COVID-19, how and when do I find a break from all of that virus input?
Yeah, that's a hard one. I've actually talked with several people who that was their role, and their role was to stay informed. They had to keep the news on all day long, and that's an important role to play. I do think that if you can take some time in your day to disconnect, can be really, really helpful. Let's, during your lunch hour, your 30 minutes lunchtime, make sure that you are completely disconnected. And I would include leaving your phone, or if you are using your phone, have it be for something social, have it be for a way to connect to positive people in your life, and not to the news of what's happening. And finding other ways of having pressure valves so that you can release some of that tension and the pressure that hearing all of that all day long will build up. And that's different for everyone. As long as it's a healthy coping mechanism, that's the piece that's so important. So again, maybe it's exercising, maybe it's going for a walk, maybe it's sitting in your garden and looking at the beautiful springtime flowers right now. Or taking a mindfulness app and practicing some mindfulness activities. Making sure again that you're building in more of those pressure valves for yourself so that you can release some of that pressure and not less of them.
Thanks, Don. I agree with that, and maybe I would add one more thing is to find some time or opportunities for gratitude, for us to be able to remember what we're grateful for in our lives. Right now it's such a tough time, but it does give us the opportunity to reflect and remember the things that we are grateful for.
Well, great. Thank you. And I think that challenge of getting a break from it, if it really is required, is an added challenge for sure. And we're seeing that for if it's their duty to report on it, like you mentioned, Don, or giving support for people who may be infected or have anxiety about that potential and providing that support. I think it's kind of the topic we're on, that provider burnout that can happen, and managing our own thoughts and feelings that are natural reaction of anxiety to this, and not getting burned out and trying to care for others. Any added thoughts?
Yeah, compassion fatigue is a very real thing. It's a real thing in normal, regular times. So, it can only increase during this time. And knowing that we're all potentially vulnerable to compassion fatigue. If you work in a helping profession long enough, you're going to experience compassion fatigue at some time during your career. That's just a reality of it. So acknowledging, knowing the red flags for you, knowing the symptoms of when you're starting to feel that burnout and you're starting to feel that fatigue. And again, the best thing to combat compassion fatigue and burnout is self-care. So what do I need to do in order to take care of myself? What do I need? What are the things that I need to be doing more of and not less of? And can I take a day off? Do I have time available to be able to take a day off? If you have that ability, making sure that you are using that. And I've talked to several people who have said things to me like, well, I don't think I should be taking time off right now because I don't want to use my vacation time to sit in my house, or I don't feel like I can leave my coworkers right now. And reality is that you would probably be better off in helping those around you more if you take a day or two to help yourself, refuel and re-energize than if you push through this and continue to burn out. So really thinking about the long haul and reminding yourself that, if you're not refueling yourself, you're not going to be able to help anyone. So it's really, that reminder of I need to put the oxygen mask on myself first, and then I can put it on someone else.
Yes, absolutely, and great point. Dr. Zen, any other thoughts on that part too?
I was just going to use that analogy, Don. That's, but I think it's true. We have to be able to take care of ourselves, take care of our loved ones, and in order to care for others. So using the self-care principles we've described are important. One thing we haven't mentioned that I think we should too is it's easy during these times to maybe take an extra drink, or you get caught up in stuff that is less productive, other drugs that aren't really for therapeutic reasons. So that's something also to be mindful of. We're all vulnerable to that during these stressful times. So being able to recognize that may be a symptom of what we're experiencing, and it may be a coping mechanism that ultimately isn't going to be so effective in the long run. And if we're finding that's happening, whether it's for ourselves or for a loved one, being able to sometimes gently address that is important.
Yes, and great point, and thank you for bringing that up as well. So I think we've covered a lot on the self-care and some of the symptoms. Transitioning some, and doesn't mean we can't talk about those other topics more, but one thought, how can we adjust to the realities of the new world as we emerge from social isolation and move to the next phase of this? I think that's going to be its own challenge. And Dr. Zen, you want to start us off on that? How do we make that adjust to new realities?
I think that's a great question, Rob. One of the things that I think many of us have found comfort in with all of this is we're doing this all together. We're all social distancing. We're all feeling anxious about the situation with the virus itself. We're all trying to avoid getting sick physically. I mean, that's been our job right now for the past, gosh, how long has it been? It feels like it's been forever. For the past 7 weeks. That's what we've been busy doing. As we emerge from this, it's not going to be as clear-cut, an end time as the beginning was. We all kind of went into social isolation pretty quickly, but we're going to emerge out of this more slowly and gradually. And part of the problem with that is there's going to be a lot of uncertainty and ambiguity about what's safe, what can we do, what can't we do. There'll be a lot of different opinions. We can anticipate that, with some feeling, that things are safe to go ahead and do, and others being more tentative about that. And one of the things I would think of is those that are rapid adapters to new technology, and those that are slower, they're going to be rapid adapters to trying to get back to normal, and others are going to be slower about that. So that's normal. We can expect that'll be the case. One thing that will be there, I think, still for most everybody is anxiety. As we try to reemerge from the effects of the virus. I think that issue of control is important. Being careful to control the things that we can, like our own reactions, as best we can, but not expecting that we can control others so easily. Being able to separate that out may become crucial as we move forward, and so that if different people are reacting, differently from us, that's okay. To be able to expect that would be the case. I think some of the same self-care things that we've talked about hold as we emerge. How can we take some of what we've learned from this experience forward as we hopefully emerge into something resembling a more normal situation in the future. So learning from this, I think, is very important.
Great points. Thank you. Dawn, you want to share your thoughts on that one?
Yeah, I read an article recently that I thought put it very eloquently, that people have been saying that we're all in the same boat together. And in reality, we're not. We're in the same storm, but we're all in different boats. And we're all experiencing things having different sets of resources and different things that are in our boats. And so what might be best for you may not be best for your next door neighbor, or your loved one. And so really figuring out what is the best thing for me as I reemerge, and what's gonna be most helpful for me. Because there are people who are, again, grappling with economic issues and financial problems and need to get back to work. And so their willingness to do some things or to take some risks might be different than yours. And so understanding that we're in different boats, but we're experiencing the same storm. And so we've all got to figure out what's safest and best for us. And we need to do that as a community, and we also need to do that as individuals as well. Um, Part of the issue with the reemerging is it's also extremely uncertain. And it's extremely uncertain what's going to happen in relation to that. And are we going to see a second wave of the virus coming through? And all of those things, again, are things we don't have in our control, and we don't really know what's going to occur. So the best thing is to try to stay as clear and as calm in making the decisions that we have to make for ourselves, and recognizing that we also need to be patient with people who may have a priority that might seem different, or not in the same line with us. And so recognizing that as a community, we're going to have to figure some things out. And that even as we reemerge, there's going to be certain levels of how people go back to work and when they go back to work, and safety precautions are still going to have to be in place. We're going to have to do things differently than we did before. It's not just going to be everybody's going to open their doors one day and everybody's going to go out and life's going to go back the way it was. That's not how things are going to probably fall into place. It's going to be more of a slower transition, and we still need to be cautious, and we still need to make sure that we're taking as many safety precautions as we possibly can. And that's true for our physical health and our mental health as well.
Well, thank you both for your thoughts on that. I think that one is, I know it's on my mind. I think that's one that's on everyone's mind of certainly now we've gotten to this point, now what and what's next? And I know there's great discussion going on right now and different thoughts in different states of what's the right timing and how do we do that? And I do think that that's going to be a big topic going forward. So I appreciate your input on that. I'm looking to see if I have any other questions. I think that we've gone through the questions that we have. Again, I appreciate everyone's input for that. And as I said in the beginning, this is really meant to be interactive and really meant to be information that can support us all experiencing the same storm in different boats, as you put it so well, Dawn. And so before wrapping up, I want to make sure to give a moment for any final thoughts. So Dawn, we start with you. Any last thoughts, last words of wisdom for the people who are on our webinar today?
Yeah, I really just want to encourage everyone to be patient with themselves and with others. And as much as we can remember that we are in the same storm together, and we need to look out for one another, we need to do everything we can to take care of ourselves and our larger community. And I think Dr. Zen made an excellent point that when we are caring for others, we tend to not be so focused on our anxieties and what we're fearing. So the more that you can do whatever it is that you can do to help someone else, and that might just be a phone call. I'm just calling to check in on you. I was wondering how you're doing and how you're managing, and I care about you, so I wanted to pick up the phone and call you today. It can be something as simple as that. That every day doing things to help take yourself outside of your own head, and focus on something else, or someone else, can really be helpful. And know that, some things you're going to try aren't going to work. Not everything's going to be helpful. But we keep trying, and trying different things can really make a difference. And when you find something that does work, use that. Keep doing that. And know that there are resources out there. Mental health organizations are still open. We are still here, and we're available for you. So again, reach out, make those phone calls, contact your provider if you have one, make requests for services. If you don't have a provider, now's a great time to access one. So there are a lot of providers out there offering telehealth, like we're talking right now here today. And it can have an impact. It does work. So don't give up. Keep trying.
Thank you, Dr. Zen.
Yeah, that's great, John. I think you really hit on a lot of the major points. There is help out there, and mental illness and mental health struggles are something that we know people deal with all the time. The incidence in our population is huge. Depression is the #1 cause of disability worldwide. So this is a problem before COVID. But we also know that COVID is having significant effects on our physical health and our mental health. And so it really is important for us to take care of ourselves, take care of our loved ones, be mindful about that, and to be able to reach out for help. If you're struggling, if you're uncertain as to how much you're struggling, and whether your struggles are normal or abnormal, it really is reasonable to reach out for help. Stay connected. Even though we're more isolated than we had been, and that's likely to remain for a while, it doesn't mean that we have to be socially distant. We can be socially connected in so many ways now that we didn't have available to us before. So it's important for us to stay connected even when we're isolated.
Well, great, and I want to thank both of you so much for your time today and your insights. I really think it was helpful for everyone on the webinar here to hear just the support and the empathy and understanding and insight that you all have to be able to share. I also want to make sure we mention this webinar today was truly a collaborative effort put on by Mission Health, Mission Employer Solutions, and the Employee Assistant Network. And we really wanted to make sure that we were capturing the needs of the community as much as possible, and appreciate the questions coming in from our viewers. That really helped us to be able to hit on that as much as possible. Also want to make sure everyone is taking note of what you see on the screen now. There are plenty of resources available, and some that the state of North Carolina has put in place specifically around COVID. So that Hope for You NC helpline is a great resource that put into place to help support. And everything that's there, as has been mentioned, essential resources and essential functions still open, still accessible, and want to make sure that people are getting the help that they need. And at the same time, make sure we're supporting each other. So with that, want to make sure that everyone is staying safe, staying healthy, and have a great rest of your day. Thank you.
Thank you.